let's talk about central lines. So what even is a central line? A central line is an access device that leads directly to the heart. Whereas a peripheral line might go this far, a midline might go this far, a central line is going to go all the way till it terminates at the heart. Now you can have central lines everywhere. You can have a central line in the neck. This would be considered an IJ, an internal jugular. You could have a tunneled catheter here, a subclavian. You could even have a peripherally inserted central catheter or a PICC line. So it starts at the outs and goes all the way up. These can be in the femoral artery, or these can even be in the chest here, like this, like a Kim port. That's considered a central line. Also, your hemodialysis catheters, these are considered central lines as well. Now, your normal everyday nurse is not really supposed to be messing with these, but this is a central line. You can have triple lumen, you can have single lumen, and you can have double lumen PICC lines or central lines. And what's interesting about these lumens is that each one of these lumens is its own dedicated line. So for instance, I don't know if you can see that, you can see the three little holes there for the three different lumens, the three different pathways for the medication to go in, which means the medication doesn't mix within the central line. It mixes once it makes it to the heart. Also, you may even see the words proximal and distal. That's actually in reference to where is the medication releasing. Is it releasing proximally or is it releasing distally? Now, why is it that people get a central line? You don't just get one because, oh, this patient's a hard stick, let's give them a central line. No, what you're getting a central line for is if, number one, are they getting a vesicant? Are they getting some kind of a medication that is dangerous to receive by the veins? Because if it infiltrates, it'll actually destroy the tissue. This could be things like high doses of potassium or TPN, chemotherapy, long-term antibiotic use. Or if your patient is just hemodynamically unstable, you might see someone with a central line. People with those long-term needs, IV needs, might go home with one of these. And your biggest concern when you have a central line is going to be infection. You don't want bacteria from the body to make it up here, because if it comes in here, it goes down to the heart, then it goes to the rest of the body. Not only is your hospital not going to get paid for that hospital visit because they've got a central line associated bloodstream infection or a CLABSI, but also you're going to have your patient have to spend more days in the hospital. Potentially they could get septic and even die. So that's central lines in a nutshell. Hope you enjoy.